Are you a diabetic or know someone who is a diabetic? And are you someone that's afraid you might develop diabetes and want to know how to prevent diabetes? Well, guys, make sure you're tuning in because on today's video, I am going to talk about how you can prevent or delay type 2 diabetes. So guys, this is Diana Bitucci. Welcome to my channel. This week's video, I uploaded a video about what is diabetes and signs, symptoms, and possible complications of diabetes. But today I want to talk about how you can prevent diabetes because I think that that's actually more important, is what can you do to prevent or delay the onset of diabetes. If you haven't seen that video though, make sure you guys check it out. I will link it up above. In the earlier video, I talked about diabetes can cause obviously a lot of serious health complications, heart disease, stroke, vision loss, amputations, kidney disease, and much more. No one wants to develop diabetes, and we certainly don't want to develop complications of diabetes. Those complications are very serious and something that we have to learn how to live with. So you can help prevent or delay type 2 diabetes. Actually, if you are someone that is overweight and are inactive, or you are overweight or obese, you can actually help prevent or delay type 2 diabetes by losing a modest amount of weight by following a reduced calorie eating plan and being physically active on most days of the week. So what does that mean exactly? Well, let me explain it to you guys. So they did a lot of research on this. So diabetes has been around for a long time, and fortunately the good news about that is we have learned a lot throughout the years, and science has gotten very far with regards to diabetes. Knowledge, how we can treat, we've gotten very far on different treatment options, insulins, pumps, sensors, etc. So if you lose weight and you're able to keep it off, so you can prevent or delay diabetes by losing only 5 to 7% of your starting weight. So you're wondering, well, what does that really mean? What it means is if you weigh 200 pounds and you lose about 10 to 14 pounds, you can actually prevent or delay diabetes. So I know you're hearing this word delay and you're wondering, well, what does that mean? Delaying diabetes is very important. For example, I have a family history of type 2 diabetes. Therefore, I am at higher risk for developing diabetes just by my genetic factors. That means I can't really control my genetics. We don't get to pick our families and our genes. So with that being said, although I could develop diabetes in the future, but I can delay it by staying active and keeping the right amount of weight, eating as healthy as I can. If I were to develop the diabetes at age 60 because of my genetics, I can probably delay it and not get diabetes until I'm 80. That is extremely important because diabetes is a progressive disease, which means the longer we have diabetes, the more likely we are to endure complications such as the ones I mentioned earlier and also in the previous video that I uploaded. So that means that if I can get diabetes at age 80 and I'm able to delay it just by leading a good lifestyle, that means I am potentially eliminating or delaying any complication of diabetes that I can get. Versus developing diabetes at age 50 or 60, I am less likely to be able to prevent diabetes just by the nature of the disease. Although with managing your diabetes very well, of course, you can minimize the possible complications, but we can never really eliminate them, unfortunately, no matter what we do. But if we delay diabetes, that is a very good sign, and we all should want to delay diabetes, even if we have very strong factors that we may develop it. And if you are watching and you are that person that's very inactive, maybe you have a desk job and you come home and you're not really moving around, well, get moving because that's very good. Getting at least 30 minutes of physical activity 5 days a week is actually very good and has been known to delaying the onset of diabetes and potentially preventing it. So, and I'll talk about some exercises, but just 30 minutes, you don't have to do anything crazy. It doesn't have to be a marathon. Just doing more than what you're doing 30 minutes a day is excellent. And then eating healthy foods most of the time is excellent. So eating smaller portions to reduce the amount of calories you eat per day, and can help you lose weight, but also can help minimize the amount of sugar that you're putting in your body. And of course, I always recommend drinking water instead of sweetened beverages because sweetened beverages are just full of sugar, loaded with sugar, Water is the best for us. Even if you like a little carbonation, normally seltzer waters or carbonated waters are fine. They don't pose any risks to our health or to our blood sugar levels. But I always say eliminate sodas, eliminate juices. Those are just loaded with sugar and they don't have any nutritional value. So you're not really getting anything out of it. So I normally say start replacing that, because normally patients will actually see a difference in their weight just by eliminating the sugary drinks alone without making any major changes to the diet. So that's really, really good. Some good exercises for diabetics are walking, and this doesn't require anything. It's free. You don't need a gym membership. You can just, walk right outside or go to a park that you enjoy going to. And, as I mentioned, going for a brisk 30-minute walk 5 days a week or most days of the week is very beneficial, and it is recommended by the American Heart Association as well for keeping your heart healthy, but obviously for preventing type 2 diabetes. Patients are older and sometimes they have issues with their knees, their joints, and I normally recommend cycling because this is actually very good. Especially for, as I mentioned, a lot of patients can have neuropathy because of diabetes. They have poor sensation to their legs, to their feet. They have joint issues. So this is good because it's very low impact exercise, and it can help meet the requirements of the 30-minute, 5 days a week exercise plan. And it can help lower blood sugar levels, obviously, without causing so much impact on your joints. And then yoga is also a very good choice for exercise. And the research shows that yoga actually reduces blood sugar levels, cholesterol levels, and also helps maintain better weight. And it can help lower blood pressure and improve your quality of sleep, and actually boost your mood as well. So we know diabetes is linked to higher levels of anxiety and depression, unfortunately. So yoga is also a great any activity is also great, for our mental health. But yoga is directly linked to improving mood, reducing anxiety and depression. So please comment below and let me know what are your favorite exercises. And I hope you guys enjoyed this video. And if you did, please give this video a thumbs up and subscribe to my channel. I will see you guys all next time. Take care.